Good morning. So we had a long day yesterday, and my voice is coming in and out. So that is, usually I'm not this, like an octave, I'm maybe an octave higher. I don't know. But no, for those of you who don't know, I am Representative Dan Miller. You are in the Bethel congregation, which is our long-standing home for the Disability and Mental Health Summit. How's it sound? Frog? Little frog? Great. I'll keep it. All right. So you are in Bethel, which we are always glad to be. They've done fantastic. They've kept us here for 9 years, which is amazing. 9 out of the 11 years of our summit. We really appreciate it. A lot of you went through the rain. I heard some expletives in the parking lot. I was like, man, it's a synagogue. Get them out now. But we appreciate everybody who's here today with it. And look, as you, for those of us who joined, who maybe missed yesterday, we had a great day yesterday. Governor Shapiro was here, and he's kind of like a rock star, and he wanted the lieutenant governor to know that he came here before Austin did. Although I then gave the governor a hug and told him that Austin's been here for years. But I didn't want to ruin the moment for the governor. But he was obviously the first governor that we've ever had be here, which was fantastic. And look, our whole point and why we are trying to move back in, switching up into multi-days and trying to bring more attention is time is ticking by. The reality of it is every month and year that ticks by where services aren't where they need to be, where opportunities aren't what they should be, those are days and years that don't come back. And we have promises to keep. Overwhelmingly, the majority of issues that we talk about with disability and mental health, we're not talking about new programs. We're talking about funding the ones we said we would use. And when we don't fund them, they die on the vine. And when we don't fund them, we create thousands of people on a waiting list. And when we don't fund them, tens of thousands, if not more, hundreds of thousands of Pennsylvanians are not living the full life that they would want to. And the ripple effects of that, where other family members also try to help and everything else down the road, down the line, doesn't work. As a retired firefighter, one of the things that we would often say is, I need to be sure that my hose is flowing. I need less friction in my hose. Life is tough, whether you have a diagnosis or not. But when you do have a diagnosis and you have an underfunded system, you have a lot of friction in your hose, and it's making it tough. So look, this morning, I am very honored to have two guests. We're going to hear from one first. The amazing thing about this, of course, is not only have they both been here before, but they both were state reps, colleagues of mine, so I'm very excited. So first, I'm going to please join me in welcoming the first time we've ever had a lieutenant governor here, Austin Davis.
Thank you so much, Representative Miller. Let's give Dan Miller a round of applause for putting this event on. It's so great to be back here at the Disability Health Summit. I know you all heard from Governor Shapiro yesterday, but we're so excited to be tag teaming this event. And I want you to know it's not often that an event gets both the governor and the lieutenant governor. And I think that's really a testament to the leadership of Representative Miller and the work that he does in here at Harrisburg each and every day. This summit embodies something that I believe deeply, and that's the people closest to the pain should be closest to the power. This event brings together self-advocates, family members, and service providers with elected officials so we can learn from all of you. I want to be clear, you have power, and your stories have power. As a state representative, I had the honor of helping many of my constituents get access to accommodations that made their lives better. And now as your lieutenant governor alongside Governor Shapiro, we're working every day to deliver for those families. We all benefit when people with disabilities can stay in their homes and in their communities where they have the opportunity to work, spend more time with their families, and experience a good quality of life. The governor and I are working every single day to deliver real results for the good people of Pennsylvania. We have only just begun, but we've had a number of significant wins. Last year, our administration secured over $17 million in our budget to help an additional 850 individuals with intellectual disabilities and or autism get off the wait list for home and community-based services in 2023. Our second budget that the governor announced in February continues to invest in Pennsylvania's system of care for intellectual disability and community by investing a total of $483 million, $217 million in state funds, and drawing down on an additional $266 million in federal funds to provide more resources for home and community-based service providers, to pay competitive rates for staff. This is going to significantly increase the typical salary for those workers. You know, we've also worked to improve challenges with mental health. Particularly in our first budget, we secured $100 million for school-based mental health services. We know that young people are dealing with more challenges now than ever before as we come out of the COVID-19 pandemic. And we need to make sure that we're continuing to support them and their families. The budget the governor is proposing this year proposes another $100 million in mental health funding for our K-12 schools. That's a significant investment. We have and are going to continue to provide services and funding for our most vulnerable residents. And I want to personally thank each and every one of you for your advocacy, for your work, and for the elected officials every day who continue to stand up in our Capitol and all across our Commonwealth in fighting this fight. Thank you all for having me today, and let's have a great conference.
AD, hold on. You know, and look, I think a lot of people, some people may not know, but Austin and I we go back a long way. So, and I can't tell you how excited I am, not only for my friend to be here again, because he's been here many times, but just in his role as Lieutenant Governor. So first of all, thank you for coming, Lieutenant Governor. I really appreciate both you and Josh making this a point to be here for this event, so thank you.
Thank you.
On the one side of it, though, let me ask you this. Just personally, why have you always come for the Disability and Mental Health Summit?
Yeah, you know, I think it goes back to my motto, and I said it earlier in my speech, the people closest to the pain should be closest to the power. And what really started me on my journey in public service is not seeing anybody serving in public service who looked like me, someone who didn't represent my life experience. And I vowed that when I became an elected official, I would always be an advocate and a fighter for marginalized communities in our Commonwealth. And I view it as a responsibility to lift up the voices of the voiceless. I recognize that I have a significant responsibility as Pennsylvania's first black lieutenant governor to make sure that I'm not the last and that folks who have different lived experiences have the opportunity to serve and contribute to our society.
Thank you, and you know that's when we talk about Representative Benham and Representative Salisbury and those who represent aspects of the disability community, I very much appreciate them and you talking about not being the last of anything and how we broaden opportunity and bring more people in to the discussion, not less. Again, I want to thank him. He didn't have to be here. Please join me for thanking again our Lieutenant Governor, Austin Davis.
Thank you.
Okay, get out of here, Austin. You know, look, when we started this event, it's always been a partnership between a variety of agencies that operate in the disability and the mental health field. Obviously, private and public overlapping to try and make a system work in a state that is unique in some aspects with how it functions. There's a lot of things we do well. There's a couple things we need to continue to improve upon. That partnership has always included a discussion with Allegheny County. Every year that we have had our Disability Summit, Allegheny County has always been here in a variety of ways, sometimes giving presenters, often obviously providing multiple resources in our resource fairs. And we have always had, I think almost always had, the county executive stop by, which we appreciated the former county exec because he would stop by, say hi, just take a look, and then continue on his way. And there's nothing wrong with that. We appreciate it. That being said, what I was very excited by was when our new county executive took office. Her and I had a conversation really early in her term about the Disability and Mental Health Summit and the role that the county plays in providing and assisting in those life-sustaining services. So Sarah has been here, I think, every year that she has been in elected office. She's come to the summit, which I appreciate it. But she is this is the first time that a county executive, let alone someone who's only been in the role like 4 months, has decided to come here not only to say hi, but to sit down and have a discussion about what her vision is, where the county's going, what we can do better, and what she hopes to see. So please join me in welcoming our new county executive, Sarah Innamorato, to the... And Sarah, thank you, and Erin's joining us up here as well, right? Yes. Yeah, Director Dalton. You guys may remember Erin. She's been, Erin, how many, I don't know, 4? So Erin, please come on up as well. Erin Dalton, Director Dalton, why don't you go right over there. So I'm going to take a little bit of a step back just because Sarah knows my voice sounds fantastic. So, yeah, first, Sarah, thank you for being here. And why don't you say hi and let us know how you're doing today.
Sure. Good morning, everyone. Good morning, good morning. And thank you, Representative Miller, for having me back in this new capacity. It's been wonderful to be here in the past and to get to know folks and to see faces again and to talk about how we build a more just and diverse and equitable and accessible world for everyone. And before we were talking about it in the state lens, and now we get to talk about it on how we actually take those dollars from the federal and state and put them to work in our communities. And that really is what county government is all about. And I want to thank Lieutenant Governor Austin Davis for his words. And he actually served on my transition committee, which we wrapped up our first 100 days in office this week. So we had a nice celebration around that. So he was integral in helping us make sure that we had multiple voices at the table as we were doing that work. So before we kind of dive into the deeper conversation about what the county is actually doing around making a more accessible region for us all and focusing on mental health and disability, I want to talk about the approach I have to county government. So the day after I was elected, and before I was sworn in, we announced the All In Allegheny initiative. And the idea behind that was saying, how do we bring those voices, how Lieutenant Governor Austin Davis said, how do we bring people who are closest to the pain, closest to the power? Build the tables so that there can be more decision makers around them. And we did that with the All In Allegheny initiative. We brought together 200 community members across the ideological and political spectrum. We brought folks together from all backgrounds, all races, all ages, all identities, and all disability statuses to make sure that we could come up with a plan forward for the county. So this is in the plan that we launched on my 100th day in office, the All In Allegheny plan, with 91 recommendations on what we're going to do to actually build an Allegheny County for us all. They're not Sarah Innamorato's ideas. They are the community's ideas. And not only did we have those 200 community members at a table, but we created a survey. And we worked with national consultants to bring together this group of people, and they said, hey, you know, we've worked in New York City, we've worked in Houston, we've worked in Oakland, California, and, you know, 10,000 survey completions, that's a good amount. And when all was said and done at the end of February, when we closed the survey, we had 19,000 responses, which is incredible. And in a time where trust in government is plummeting and people are opting out of participating in our elections and government and civic dialogue, you know, that gives me so much hope. And we were very intentional about how we were putting that survey out into the community. It was translated into 9 different languages. Each one was used. We had 27% of our respondents self-identified as having a disability or a chronic illness. So we know we heard greatly from the community that you all are a part of or care about. And you know, we use that information to come up with this plan that we launched. And I just want to, before we dive into some details, want to talk about kind of the 91 points, what are the ones that really are of interest of the folks who are here attending the summit? And so, you know, the first one is, you know, making voting more accessible to folks and making sure that our elections are secure, but that we have options for folks. And so, you know, as of last week, we still had 64,000 mail-in ballots that had not yet been returned, but I'm proud to say that this weekend you can go out and you can return them at our ballot return sites that we have all throughout the county now. So please, if you're holding one at home at your kitchen table, take it to one of the return sites that we have open this weekend, Saturday 9 to 5, Sunday 11 to 6. And, you know, outside of that, you know, making sure that we're centering youth mental health, that was something that came up quite a bit in our conversations out in the community, but also in our survey results. In fact, that was the number one thing that most of the county, the zip codes in the county, said they wanted us to focus on, was more solutions for mental health. And we have come up with some ideas on how we can do that and worked in partnership with our county employees and our county leaders to do that. So some of the things that you'll read about in our All in Allegheny plan is creating new mental health and postpartum mobile treatment units, creating a unified system that makes it easier for youth mental health hospital beds during a crisis, launching programs in which trained mental health and medical professionals respond to mental health crisis calls, increasing mental health and medical staff at the Allegheny County Jail, expanding social emotional learning in schools in partnership with the Allegheny Intermediate Unit, and supporting teen mental health supporting the Teen Mental Health Collaborative to improve community-based triage, early intervention, and connection to services. So those are just a few of what the county will be working on in the short term and the long term. And you know, that's why I brought Director Dalton here today with me, because we're going to dive in deeper into some specifics on how we're going to make those promises a reality out in our community, and I know all of you will be a part of that.
Well, thank you. Doesn't sound like you have much to do. No, but thank you, Sarah. I did do that survey, so I hope a lot of you did as well, and it's really reflective of how Sarah, in my opinion, governs and makes decisions, and she wants that input. My belief is you're going to see that continuing throughout her term as county executive. So, Sarah, obviously the area of disabilities in particular is a big one. Just in relation to what parts of county, your county administration, your county government touch on disability, can you give us some insight as to what and where those touch points are?
Sure. I mean, the answer is every department in county government should have their eyes on how to be more accessible and how to actually, you know, support individuals with disabilities. So it starts in everything from our administration department, which makes sure that we administer elections and ensuring that every polling site is accessible, that our training to be a poll worker is available to everyone who wants to participate in that process. It's our department like facilities, where every county building that you walk into can it accommodate you? And right now the answer is no, it can't. So we have a lot of work to do in that space just to improve our physical space so it is more welcoming and inclusive of all people who want to visit and connect with your county government. And it's places like the jail. We are working on ensuring that folks who come through that system, that they're evaluated, that they're hopefully diagnosed, and that they can receive the proper treatment and care while they're in that facility. We actually have our ADA coordinator, Kaylin, who's here. I think she is sitting she's right here. So please, at some point in the day, talk to her, tell her about your experience that you've had with county government, with going into a county building, something with a county program. We have so much work to do because we're such a large institution that we do miss the ball sometimes, and we need to be able to hear from the community and to act on that feedback in a meaningful and comprehensive way.
It's always easier to start a policy and initiative when you've already designed it to be inclusive. Obviously, so much of the county, you're not creating, you're inheriting here. Yeah. But how embedded is your inclusion vision from the start of your, when you are creating a new policy or a new initiative like All in Allegheny County? Mm-hmm. You're starting at from an inclusion model, you're putting that into your plan?
Yeah, absolutely. We've started with centering equity. Is how do we bring the most amount of people to the table so that we can co-design solutions for all of the challenges that we're facing as a society, as a county government. And obviously, Department of Human Services is integral in the actual administration of a lot of the programs and policies that we think of when we think about addressing mental health and providing services to folks who have a disability or have a substance use disorder. And I want to give Aaron the opportunity to dive in a little bit deeper on how DHS centers that work.
Yeah, thank you. Morning, everyone. I'm so glad to be here with you. Certainly, many of you know the Department of Human Services, and we fund and support initiatives to help people who are facing disabilities. And one of the things I think that is an opportunity is that we do make all of our policies available. And so one of the things that I heard come up in the transition discussions from community members, from folks that came together was, we want an equity, we want a disability lens on everything you do, right? And so I think I certainly welcome people taking a look at those policies, always telling us when we could do better, but really looking at them through a different lens. People create policies and then they kind of just stay up there. And if you don't take a look every once in a while and make sure that you're kind of keeping up with what people want, you miss opportunities. So I certainly welcome that kind of review from folks as well.
Yeah, kind of like an inclusion audit, sort of as to all the policies that you have and how they interrelate or how they're open and available.
Yeah, and I think it does start with making that stuff available, right? And so I actually don't know the extent to which across the whole county policies are available, but we have the mechanism, we have the kind of platform to make those available to folks, and then in your free time, you can review all of the county policies.
Yeah, Sarah, I'm sorry.
I was going to say, too, so, despite having been here every year, and I would say, I'm open-minded, I'm always learning, and, I've still missed when I've done certain initiatives, and was something that came up in our conversations at one of the All in Allegheny events is around housing. So I've been a huge housing advocate around, everything from helping folks who are unsheltered to building more affordable housing to home repairs and keeping seniors in their homes. And something that I didn't realize is when we are approving public dollars to help subsidize affordable housing, it's not always a given that that housing is going to be ADA compliant, that it's going to be accessible for folks with mobility issues or with people who use wheelchairs. And, that was eye-opening to me of saying like, oh, we should really look at the way that we are incentivizing affordable housing and ensure that we're building accessible and affordable housing, especially because this is such a critical issue for the county as a whole and a priority of my administration.
Yeah. Sarah and I, of course. Yeah. Sarah and I, of course, had, Sarah used to have a state house office, right? So the funny thing in some ways was when we both had to get our leases done to have those state offices, I was shocked when we found out that I had no requirement to have an ADA compliant office, right? You remember that? So, yeah, and more what comes up, where's Richard? There's Richard right there. All right, my friend Richard would come to see me, and we asked how to get interpreters so Richard could come talk to me. And instead from Harrisburg, we got a memo about how we did not have to help him have interpreters to come talk to me. Yeah. Right, so that was too often the answer. Okay, so hey, mental health, which I know is going great. County, look, workforce issues are massive, I'm sure, and you guys have so many things that you have to touch on with mental health. How is that going with your workforce recruitment and, sustaining the workforce? How's that going?
So I will say day one in office, the thing that I did was raise the minimum wage for all county employees and add 2 extra weeks of vacation to their benefit package. Because when we're talking about any of this work, it can't get done unless we care for the people who are providing the tools and resources and services. County employees make the county run. Don't get it wrong. It's not the executive. It's all the thousands of people that we employ. Actually, I got to meet someone, Peggy, who is over there in the green. She just retired from the county after 40 years, and it is dedicated civil and public servants like Peggy who really make sure that we are delivering the services that you all deserve. And so, we have to make sure that those are some basic things. That vacation time hadn't been looked at since I was playing with Beanie Babies. So it was about time for that policy to be modernized, and we're going to do a lot more in that space. But one of the things that we are specifically working on in the mental health space is recruiting more behavioral health fellows to join county government. And we want to make sure that we're not just recruiting candidates, but recruiting diverse candidates. Because we know, especially when it comes to mental health, that you have to be able to see yourself in the person who's providing services. So we need to ensure that we're recruiting diversity when it comes to gender, when it comes to sexual orientation, when it comes to race, when it comes to faith backgrounds and different cultures. And so, we're designing that program with that at the center. So it's not just about that recruitment and training, but it's also about, being very intentional about the diversity of the people who are looking towards being in that program. And part of that is offering some competitive wages and some loan forgiveness. So there's some monetary incentives in order for us to attract a much needed workforce.
And I can't tell you, Sarah knows this, I worked for the county for 11 years, and my salary as an attorney, so I went from the public defender's office to the county law department. And in those 11 years, my salary went from $36,000 to $41,000. So it was an amazing run. So that's why I was so glad to join Sarah at her press conference day one, just looking to change the discussion, the dynamic. And look, pay and benefits are clearly part of an issue. There's no doubt about it. But that workforce issue, we're not just hearing it in Allegheny County. It's statewide. It's nationwide. And I often feel the state is dumping these issues to the counties and acting like you guys are supposed to figure it all out on your own. So
Yeah. So just to expand on the BH Fellows a little bit, that is a place where the state really helped. We used, for those of you that understand all of the details of this stuff, the underspent money from Medicaid to invest in that program. And so we brought on dozens of behavioral health fellows with that state approval. And they've served, to date, over 1,000 clients. And that is a big increase in the workforce. And so we're really appreciative of that kind of a partnership with the state. And certainly we could use more dollars, and we could use more flexible dollars. So I'll never say no to the state offering more. But another kind of workforce issue that I could touch on, a place that we were able to be innovative, and here we used federal Recovery Act dollars. Maybe some of you saw we put out a solicitation about a year ago for informal mental health supports. So I think many of you know that some people are great getting help from traditional clinicians and traditional kind of clinics, but there's so many people who would prefer to get help from their neighbors, from their pastor. And so we made an opportunity available. And we've never seen so many proposals come in, right? So we got 70 proposals for that funding, and we invested $4.5 million in bringing the kinds of peers and clergy and family members kind of off the sidelines into the work, and they're serving, probably thousands of people today. So that's another place that we've been able to really increase the workforce.
yeah, thank you. There's so much there. We're going to talk about mental health staffing in our legislative panel. We're also going to talk about the county jail in the legislative panel. And I know, Sarah, you and I have fought together for a lot of the same causes. I know you care about the county jail, the people who are there, living in there, and the services. I had to get some tea. You had 2. I had none.
I have lots of.
It's like I got to get one.
Often have many beverages.
Yeah, all right,
Yeah.
show off. All right. So, but obviously there are a lot of services in the county jail, and I just want people to know, we're going to talk about this again later today, but I was shocked, to be honest with you, to find out that the state does not help you fund those services. So it's one of those things where the state judges enforce state law, and then those judges occasionally have to decide to incarcerate people. And then those people who are in there, because state judges and state law put them there overwhelmingly, then it's left to the county to figure out how to meet the needs. And while they are in jail, they are still entitled to humane care and having those needs met and not having needs exacerbated. I know you care about it, in particular in relation to autism. But how is the work about providing services from your administration's view going in relation to the county jail?
So there's a lot of room for improvement on how the jail functions, specifically around how it provides health supports, and specifically around mental health screenings, including autism. I don't know if anyone's ever seen a jail oversight board meeting. The vibe has changed a little bit over the last few months, which has been for the best. But what you get there is a lot of public comment, and I invite any of you, if you have to speak on behalf of folks who are incarcerated or currently residing in the Allegheny County Jail, please submit your public comment, because they do work. And one month we had Lou Randall come from Autism Connection, and who is a fierce advocate and someone who I worked with when I was in the State House, and she came up and she provided remarks on how the jail was not adequately providing autism screenings upon people entering the facility. And so the next month, we're able to act. So I introduced a motion to mandate that our jail administration did that, and it passed unanimously. And so, it's sad that we had to go through the motions as an oversight board, but now it is forcing the hand of the administration to prioritize getting that process in place and making sure that as folks come into that facility, that they are getting screened and maybe diagnosed with something that they did not get diagnosed with outside that may have caused an action that landed them in the carceral system. And so, if we can do more intervention when someone is in our care, it just makes us all safer, because that means we've identified a need of an individual when they were in our care. We've been able, we can connect them with tools and resources on the inside and on the outside, and make sure that they don't come back to the jail, because that's ultimately our goal, right? Because not only is it the better thing to do to build strong, healthy, and vibrant communities and build strong families, but it costs us less money as taxpayers if we don't have a revolving door through our carceral system. So that's something that I'm proud that we are highlighting and we're working towards. We're not there yet, I will say, but we are, in the midst of starting that process.
Yeah, Aaron, obviously anytime a person is incarcerated, it is a massive break in their life, right? There are so many things that are detached, support services that they may lose connection with depending on how long they're there. And like I mentioned, the state is not very helpful in this regard. So even the what Sarah was just talking about in relation to catching some of the diagnoses and so forth, I mean, is it state required? Are you required to do any of that from the state?
Yeah, so again, this is a place where the state is taking some action, and I want to support that. We would, of course, we have flat block grant dollars, and we have to use those to spend on people that are incarcerated who need our care. But if folks haven't heard about, and certainly for the state rep, the 1115 waiver that the state has gone to the federal government with, this will allow for us to, the Medicaid door to unlock, literally and figuratively, inside the jail, and us to start to be able to provide proper care to people. That is a huge win for the people that are there, and for the county that's spending those dollars. And so supporting that 1115 waiver, frankly, helping to get it to counties as soon as possible. The state's going to start where the state starts, but getting it to the counties as fast as possible means we can pay for those services with Medicaid dollars and all of the oversight that comes with Medicaid.
See, I think you're too nice to the state.
That's fine.
Right?
We can
So
trash the
it's like,
state. I don't
Jesus.
know. It's fine.
Yeah. Look, and I appreciate so much. It's 2024, right? So these people are again wards of the state. The state is, and I'm not saying somebody doesn't deserve. I'm not taking any individual out of accountability or something. What I am saying is that if the state decides that they need to be incarcerated, if that is the state decision, then the state should be helping every county. And I know, look, you're going to hear the county jail. We're going to go into a different in a couple hours. Look, there are some things there's no doubt the county jail has to improve on. But I've also been to other jails, right? And it's a statewide issue is all I'm trying to say, is because there are jails that I've been into surrounding Allegheny County, that I've had clients surrounding in Allegheny County, and I would and did try everything possible to get them out of that jail, because I was trying to get into a better position that sometimes was Allegheny County Jail, right? So it just...
No, I mean, you're right. Obviously, I mean, there's federal prohibition on using Medicaid, but the state could be putting those dollars in. We're issuing funding next week for reentry services, really rebuilding the services that were in and outside of the jail that really struggled under COVID, of course, and providing care. But those are dollars that DHS has to put in that we are taking out of the pockets of services for mental health, for substance use disorder, for homelessness. Those are really tough choices. I certainly agree with you and implore the state to put more money into.
All right,
this.
so state sucks. You got to
Okay,
grab
the state sucks.
And also give us money.
Yeah. Did you get that? We got that
The
interpreted.
state sucks.
Yeah. Okay, I know we're. Yeah, okay, it's fine. No, it doesn't. I mean, I'm just saying. We got to, I don't know, we got to do more. All right, we're going to run out of time. I know you touched on this, Sarah. Diversion efforts, I know you said a couple words in relation to it. Obviously, again, it's, in the State House that we have attempted to do some probation reform. We got some version of that done, some version of it done this year. Yeah, I know. And then I have a juvenile justice bill, which doesn't suck, which is really good. But anyhow, so diversion efforts. I didn't know if you had anything further you wanted to touch on for that.
Miller, your bills never suck. They're always the best. Yeah, I'll touch on a couple things. First is LEAD, which is Law Enforcement Assisted Diversion. I'm proud that the first LEAD program launched in my State House district in partnership with Millville Etna and Shaler. And so that program is actually finally up and running, which takes folks who have gone through the system many times, who are they don't have a violent past. It's more, drug related, and, puts them in connection with services as opposed to putting them in a carceral system. And, that takes a lot of buy-in from the local police forces, and we have 140 police forces in Allegheny County. So, we'll do more intentional work around recruiting those forces to be a part of that program, and that's something that we can use the county as a platform to show off how this is working in municipalities, how cooperative agreements are being reached, and how those services are being administered. So that's one. We also have, county administers 988, so I'm sure folks in this room are, familiar with that. So, that's a tool that exists. But we're also launching an alternative 911 emergency response this year, which is really exciting. So it's a pilot. We're going to be working with the Allegheny County Housing Authority, as well as McKees Rocks, Penn Hills, and Monroeville. And so if someone is having a crisis, they call 911. You'll actually have folks who would come out from the county and help that individual or household with that issue, as opposed to sending uniformed officers, or they might also come. But this is incredible. And it's great because in the county right now, we have things like LEAD, we have embedded social workers in municipal police forces, and then we are going to have this alternative 911 emergency response. So we get to see what's working and what's scalable. And it's a pretty exciting time to be in this space because we're going to be able to learn a lot. We have the data guru right here who loves data so much, and we'll be able to collect that and see, what is the best path forward so that we can actually keep people out of systems and administer services and help.
Well, okay, well, that's great, Sarah. Thank you. And let's talk about schools. County work with schools to support kids and families with disabilities, mental health. What's the county involvement with that?
Sure, yeah. So the county has student assistance programs in all of the school districts throughout the county, and we embed other behavioral health supports to help support those kids and those guidance counselors and those teachers. And that's really just the beginning of linkage to other supports. And I think the $100 million that the Lieutenant Governor talked about and that funding can help to build greater resources. I think a lot more, obviously a lot more needs to be done with young people. I think the representative touched on, the crisis for young people in the community, and it was the top thing in the survey. We've got to listen to those young people and build services and supports that work for them, and they're not going to be the kind of traditional supports that maybe work for us or are generally thought of as Medicaid compensable treatment. And so it's another place where we just have to redesign and help them to lead. Actually, we're at the Department of Human Services working with a large group of community partners to redesign our teen services with those teens in mind, so that we can make sure that we are reaching them where they want to be. We've got to think about online services in the way that they're working. It's not just the pandemic. This started before then, and so it's not going to go away with the pandemic. We've got to figure out a new way to support them.
Thank you. And obviously, research shows that there are still significant racial disparities in access to care. How's the county responding to that challenge?
So it's just about embedding everything that we do and centering diversity, equity, and inclusion. And so we're going to be doing a lot of work countywide to ensure that we are living up to that value. And one way that we have, that I think DHS has been leading in the county, has been investing in racial equity fellows. And, that's a program that has been, I don't know, how long is that program?
Brand new.
Oh, it's brand new. Oh, it just started. So, thinking about, again, how we're bringing folks into county government with the lens of racial equity and inclusion. And I know that one of my goals as a county executive is to create an Office of Civil Rights, and that will include not only our work with ADA and being in compliance. We'll have some workplace safety stuff in there, but it'll also have a Human Relations Commission that functions. And we're right now in talks with the federal government on how to be certified by HUD as well as the EEOC, so that we can draw down dollars and support a staffed and funded Human Relations Commission, so that we can actually, be able to enforce our Human Relations Code that we have at the county, which offers pretty robust protections, including fair housing and anti-discrimination, but we just really haven't ever put the supports and resources behind it to make it a real thing. So, those are some things that we're working on actualizing in my administration, and but when you're talking about addressing racial disparities, it takes a lot, right? It doesn't happen overnight, but we have to be intentional. We have to have our eyes open. We need to recognize where we've fallen short, and be able to, humbly walk and acknowledge when we've messed up, and move forward, and ensure that when we look around, that the people who are making the decisions also look like the people in the county.
Thank you. Look, just so people know, we may have a time for a question or two, so if you think about something, raise your hand with it. Aaron, last time I was in the county jail, I talked to the warden, and I asked the warden what was something that his that would help him do his job better there. And he said, I need you to stop sending your sick people to me. I can't do much for them. So as far as, just so as we look towards our discussion that's coming up this afternoon, can you give us a little understanding as to what services are there currently for mental health and disability supports in the jail now?
Yeah. So the county is providing comprehensive health care in the jail. Folks do have access to behavioral health supports, but that's really going to grow in the coming year. One of the things we're really pleased about is being able to offer a full range of medication-assisted treatment for those folks with opioid use disorder. So there are not that many jails around the Commonwealth or even around the country that are able to do that. By the end of the calendar year, the jail will be able to not just keep people on medication that otherwise they are detoxing from their actual medication. Obviously, that there could be nothing more wrong than that. But also being able to induct people, start people on medication for folks for which medication will work. So the full range of methadone, which we just closed a solicitation on last week, Suboxone, Vivitrol, and so that's a big step in the jail being able to provide care. Again, I think we're rebuilding those services, right? And everyone really, I mean, that's the thing with the waiver. If the waiver goes through, then it will be the requirement, not the, like, let's hope we can do it as the county, for us to assess people for under Medicaid for disabilities, and then we will be required to provide that care. And so that is such an important leverage point. I think, as the county executive said, we've got a lot more work to do there. And again, look for the solicitation next week that will bring a lot more services into the jail.
Thank you.
Thank you. Just first of all, briefly want to thank Representative Miller and his staff here for hosting really a truly outstanding summit once again. So thank you for that. Yes. I also think it's fitting that today, published in the Pennsylvania Bulletin, are new rates for the intellectual disability and autism community. So we know that that's been very important work of our members, advocates across the state. We know County Executive Innamorato serving in the House and legislators across the state, we appreciate that commitment. We also know that this is part of a multi-year growth strategy of the state. We've heard you speak about Medicaid access and various other things, housing, employment. Just wondering your thoughts on how the county and county-based businesses and resources can help support that effort and further support and strengthen the intellectual disability and autism community.
No, thank you for that question. I will say, broadly, is just continue to show up. When there are public comments, when there are meetings, whether it's the Jail Oversight Board or the Elections Board, there are so many boards, and they all are required to receive public comment. And we know that, things pertaining to behavioral and mental health, substance use disorder, intellectual disabilities, they shouldn't sit over here as their own issue. We should be thinking about how do we embed them in everything that we do. So even when there is an unlikely space that you think that, I don't know if I should provide comment on this, but there's a way that we can improve a process, please submit public comment, be present. We want to hear from you. That's how we make a government that actually works for all of us, when we participate, when we lend our voices, our stories, our experience, our expertise to our local government. So I know that many of you have shown up, and I'll say next time, just bring a friend along.
And I apologize, Aaron. I'm going to cut it there. I know we're coming up on a hard end here. I'm going to give one final question. It's a good one. It's a good one. Okay, hold on.
I just want to thank you, Representative Miller. I want to thank you for being here and answering this question. I want to go back to the school districts. I am a former supports coordinator. I work with a colleague who was a former supports coordinator, and a lot of what we're seeing in the school districts is lack of information to the families as to how to get the waiver funding and what they need to do. And a lot of times we're seeing students at the age of 21 scrambling to get a supports coordinator. How can we change that in the school districts to get that information to them sooner?
Yeah, no, that. Thank you for that point. We're going to do a lot better on that. So we're building a new it shouldn't be new in 2024, but a new web-based tool that will allow parents to register sooner and easier online. And I do think an education campaign within the school districts is in order. We know people are getting registered too late, and we know, and we know that that's all of that time that they could have been receiving services. So I think it's a great point. And we actually at State of Human Services coming up, we're releasing our goals for next year, and that is one of our goals. So thank you for raising it.
Okay, I want to thank everybody, obviously, for the great discussion today. And I obviously, we could go on. I know I didn't get to several questions here with it. But look, this is obviously the difference here with it. I want to thank Lieutenant Governor for coming to say hi and sharing some thoughts. I want to thank Director Dalton for again coming here this summit. She's been here many years. And listen, please, it is fantastic that we have a county executive who just wanted to sit down and talk about her ideas, hear some thoughts back with it. But you could see her commitment and passion. And please join me in thanking Sarah Innamorato. My good friend, who I know is going to be doing great work in this arena. I'm very excited I'm very thankful that she's going to be the one directing the disability and mental health platform for the county going forward. Improvement, I know, is coming. She's committed to it. She's going to do it. It's going to be great. All right, listen, 10 o'clock is coming up. We have 3 sessions that people can choose from, so be sure to double check your own calendar. Supporting the mental health needs of veterans, navigating tech and mental health treatment waivers, which is always important. So you guys only have about 6 minutes. Look at your schedule. Thank you so much. We'll see you at 10 o'clock.